Hey, I'd like to welcome you to another episode of Mission Matters. My name is Adam Torres, and if you'd like to apply to be a guest on the show, just head on over to the website missionmatters.com and click on Be Our Guest to apply. All right, so today I have Tom Foley on the line, and he's the Chief Growth Officer at Genie MD. Tom, welcome to the show.
Adam, great to be here.
All right, Tom. So excited to get into today's topic. So we'll be talking about really what health system transformation looks like. We'll talk about telehealth. We're going to talk about advancements. We're going to talk about what Genie MD is up to. I mean, we got a lot of content to cover. But before we get into that, we'll start this episode with our Mission Matters Minute. So, Tom, we at Mission Matters amplify stories for entrepreneurs, executives, and experts. So that's our mission here. Tom, what mission matters to you?
At GenieMD, we are focused on supporting the ability to help the patient achieve a greater state of wellness. And for that to happen, we are focused on democratizing healthcare. At the end of the day, there are some core elements that are just not working in today's health system, and that's again what Genie is focused on. So let me go through those three quick things. One, the regardless of geography, we all have the same problem. We have a growing population, an aging population, a sicker population, contracting more and more chronic conditions as they get older. And then coupled with that, we have less doctors and nurses projected over the next many years. So you got an older age or sicker population, less doctors and nurses to take care of them. That's problem number one. Problem number two, if I am sick, the average Medicare patient with 5 chronic conditions sees 9 different doctors in a given year.
Yeah.
They only spend 15 hours in front of their doctor. The question that we're trying to answer is what happens the other 8,745 hours? That's where health changes, is in the home. And then the last challenge is that we have the payer model really is breaking. One, it's too expensive, and two, even if you had it, it's very expensive relative to co-pays and things of that nature. And there's a lot that don't have it. So you have a disproportionate number of individuals that just don't have access to care. And with technology being inserted into healthcare, it's not just about access. It's about, do you have the technology to support that access? And if you had the technology to support that access, the ability to just eat properly, one would think in America today, that would be a de facto standard, eat properly, but they can't afford the food that they need if they're diabetic. So it's just a unraveling situation. And to, again, address those matters, it requires what we refer to as democratizing healthcare in order to focus on the patient.
Wow. And democratizing healthcare. I mean, what a mission. I mean, lots of people saving lives. So it's a great
Saving
thing. And
lives.
I'm always excited to bring on people in healthcare and the healthcare industry really that are mission based and that are really aimed at improving patient outcomes and care. So thank you for sharing that mission. And we'll definitely I want to unpack some of the things that you said and definitely go further. But how'd you get started? I mean, tell us a little bit more about Tom. Like, how'd you get started on this path to Genie MD and really wanting to be involved with democratizing healthcare?
Getting involved in healthcare in and of itself started many moons ago when my father, who had every complication to diabetes imaginable, long before even any recent transformation of healthcare efforts. But that I got an opportunity. I started my own consulting company. I was focused in on healthcare, and I got an opportunity. I was working with a company that actually was doing CME work, certified medical education, and he had 40,000 high prescribing physicians. He had a whole service, and I was helping them with enhancing that quality of that service. And I read this article one day. This goes back to like early 2000s. I read this article about how much paper was in healthcare, right? And I said to him, "Hey, you got 40,000 high prescribing physicians, and you got a lot of paper. That's a problem to fix." right? I end up doing a due diligence, helping
Mhm.
him acquire an EHR company, and then running that EHR company for about a year, and then I've stayed in healthcare ever since.
Wow. And so let's go into the overall topic of healthcare or health system transformation. Maybe first define what that means for our audience, because we hear about the word transformation often, but how, as it relates to healthcare, like give us the what your take on that means.
Yeah, it's not just about the doctor's visit, as I was alluding to earlier. It really is about the continuous care of a patient. Just
Mm-hmm.
because you're not in front of the doctor doesn't mean you don't need assistance.
Hmm.
And just because you need assistance, and because you need assistance, that's not just a one-off telephone call.
Yeah.
It's I'm prescribing you to lose weight, diet and exercise, as well as
Yeah.
maybe take medical therapy. But at
Hmm.
the same time, I need some, there's just a different model about how we engage a patient on a 24/7, 365 type basis
Yeah.
versus how the current system engages the patient based on an episodic care model. Now,
Hmm.
the health system in and of itself is transforming to what they call value-based care.
Hmm.
And I always ask people, do you know what value-based care is? And value-based care is very simplistically is
Hmm.
today episodic care is if you go to the doctors, they get paid, you go home,
Yeah.
right? Value-based care is about having both, at least the provider team, having some skin in the game in
Hmm.
helping his population of, let's just say, diabetics or folks with diabetes
Hmm.
achieve a better outcomes. And if he
Yeah.
doesn't, and if they don't achieve that, they don't get the reimbursement. So everything happens in healthcare because of reimbursement.
Hmm.
So the point there being is, does the patient know that the doctor's at risk? The
Yeah.
patient just thinks of it as an episodic care. I went home and I'm going to eat that jelly donut hypothetically, right? But the
Yeah.
doctor is the one on the hook to help you get better. So that if the two are disconnected, which I believe they still are, it's just so how do you fix that problem? So the patient really needs to be empowered and engaged if they're truly going to go along this journey
Yeah.
of awareness to wellness to get to that better state of that
And
better
and
state.
and correct me if I'm wrong here. So, value-based care, that's really focused on like the outcome, the patient outcome, and that's where the monetary incentive, if you will, of reimbursements or whatever we want to say, that comes in line. Where episodic care, that's really like you're just you went, you left, and that's like another episode, if you will, of the show. It might.
Exactly. Exactly. So yeah, so value-based care, increased quality, reduced costs, better outcomes. Absolutely.
Awesome. So now as we get into this concept of democratizing healthcare, maybe paint the picture first on why it's not, everyone doesn't have really access. I don't want to assume people understand that.
Yeah, so let's use telehealth as an example.
Yeah.
Not everybody has, believe it or not, not everybody has a smartphone. Not
Hmm.
everybody has a PC. So if you're going to get involved in engaged in virtual care, how do
Hmm.
I do that? Well, and take technology away.
Yeah.
Just the copay to go see a doctor is unaffordable sometimes and many
Hmm.
times. And the CMS actually recognized this in their new 10-year strategy that they just released last month, actually,
Mm.
in that they have to make payments more affordable if, in fact, people are going to be engaged in achieving those greater states of wellness.
Hmm.
So, again, so now I can't even afford my copay, but then
Yeah.
you're going to ask me to engage in virtual care. I don't have a smartphone, and if I did, I only have it limited plans, if you will. I can't,
Yeah.
so streaming video and things of that nature is again another element. And then again, if I go through all of that and I say, hey,
Hmm.
I'm a doctor. Hypothetically, I'm a doctor, and
Yeah.
I say, hey, you have diabetes, and here's the therapy that you need to be on. But this is your care plan, right?
Hmm.
Diet, exercise, things of that nature. But if I can't afford to buy the food
Yeah.
that I need to eat, so again, you go through the entire process, and then you and then you're still not successful because you just
Mhm.
can't engage the 100% in all of what your provider is asking you to do.
So, Tom, let's switch it up a bit. I want to go further into Genie MD. So, first off, tell us a little bit more about the company.
So Genie MD, hold on, I apologize. So Genie MD is about 10 years old,
Yeah.
and we are a global company providing virtual care services.
Mm.
And one way to ask, well, what's virtual care services versus telehealth?
Yeah.
The virtual care services is and slash telehealth. One would argue that you and I are in a telehealth session right now. It's video,
Yep.
or maybe we just had a phone call. So in some context, in some definitions from CMS,
Hmm.
Medicare, Medicaid, they might call that a telehealth visit.
Hmm.
However, it's about the continuous care model, right?
Mm.
As I said earlier, nothing happens in healthcare unless there's reimbursements associated to it.
Yeah.
So telehealth. So I have my brick and mortar visit. I
Hmm.
have a follow up. I could do that virtually, just as again in a very similar session of
Hmm.
video. But then I might, and then you have remote patient monitoring, which is another service where if you do
Hmm.
have a chronic condition, and 6 out of 10 adults in the U.S. do have at least one or more chronic conditions,
Mm.
your doctor can prescribe you. Let's just say you have hypertension. Your doctor could prescribe you a remote patient monitoring. They issue you at no cost a blood pressure
Wow.
cuff, and then you have to take your blood pressure 16 unique days out of a given month, and that
Hmm.
data flows through to your provider. And if you're within range, there's nothing really to do. Well, there's
Yeah.
nothing really to do in context of change. But if you're out of range, and everybody has a
Hmm.
different range of blood pressure based on
Yeah.
who you are, the ultimately remote patient monitoring allows your physician to monitor you 24/7 if you wish. Now we've
Wow.
extended care into the home, and that's important. Now, remote patient monitoring is one aspect of it, and then you have chronic care management, where we can engage you on a day-to-day basis on, that it's almost like a health coach. You're rah-rah to some degree, right? Or your care
Yeah, that's what I'm
coordinator.
thinking about. It's almost like a trainer app or something, right?
Yeah, exactly. So, you
Yeah.
have this continuation. Again, it's the continue. It's not about urgent care. It's not about
Yeah.
primary care. It's not about the visit to the ER, and they're all important, by the way.
Of
It's
course.
really about that continuous care model if the patient is truly, again, going to be on this journey from awareness to wellness. So that's what we do. We provide each one of those
Mm.
sectors a full feature set integrated, called the platform, Continuum it's called,
Hmm.
where other competitors are probably, some do telehealth, some do chronic care management, some do remote patient
Yeah.
monitoring. I don't want to say we do it all. We do it all, but it's in an integrated state.
Right.
And if a physician engages in such a program, they can actually increase their revenues while the patient is receiving better quality of care and
Hmm.
achieving better outcomes. That's all the earlier definition of value-based care. So embrace the program, the platform,
Hmm.
as opposed to, and move off the episodic care model, and great things could happen.
So take me through, because not everybody watching this has used anything virtual care based or telehealth based. I mean, not everybody has. So take me through, and I want to kind of demystify this, because for some people, it's one of those things where they're like, I got to go to the doctor. I got it. And maybe they do, by the way, but maybe there's some things that can be done through this that are going to be more beneficial long term. So just take me through what a normal, like, or not normal, but take me through like a potential user experience with Genie MD. So they're watching this
Sure.
interview. They're like, okay, let me check out the website. Like what's next?
So let's just say you go to a website
Yeah.
of your doctors, and you're not feeling well. Let's start there. You're
Yeah.
not feeling well. You go to the website of your doctor. You fill out securely, by the way. You fill
Yeah.
out this assessment as to what's wrong.
Hmm.
In healthcare, they call that the clinical complaint, the chief complaint.
Hmm.
So you fill it out. It takes about a minute to go through.
Yeah.
So there's a couple of different questions to be thorough about it. Your doctor then gets it, and your doctor could actually take a look at it and say, "Okay, I get it. You got a sore throat,
Yeah.
right? And you've been complaining about this for the last 2 weeks, It's time to prescribe an antibiotic, hypothetically. So
Yeah.
I'm going to prescribe you an antibiotic, Tom or Adam, and
Yeah.
I'm going to send it to your pharmacy of record. That's
Hmm.
one side of the equation. Or you
Hmm.
could say, hey, you've been complaining about the sore throat for the last 2 weeks.
Yeah.
Can you join me on a video call and at 1 o'clock, hypothetically? And if
Yeah.
the answer is yes, I send you a link to your smartphone. You click on the
Mm.
link, and your doctor and you are involved in a video visit, just like we're engaged in
Wow,
a
that's
video
so
visit.
cool to me. Go ahead.
Right. So let's just take this one step further. You happen to be prescribed into a remote patient monitoring program. Let's
Mm.
just say you have a couple of medical devices with you, hypothetically, your
Hmm.
blood pressure cuff, your glucose meter, and the
Yeah.
doctor says, "Hey, let's take your blood pressure." I put the blood pressure cuff on.
Hmm.
The results come out. It goes directly to you. As a matter of fact, you'll see it at the bottom of the screen what your blood
Mm.
pressure is. So both of you can see the results. And
Yeah.
hey, let's prick your finger to see what your glucose level is. And
Hmm.
again, as that data flows, that data is captured. That information is displayed on the screen. So again,
Wow.
both you could see it. So you could do that with an EKG. You can
Yeah.
do that with actually you could put an otoscope. I can stream audio directly to you. So if I had an
Hmm.
otoscope, I'm sorry, if I had a stethoscope, I could put it on my chest and you can hear
Yeah.
it and you can see me. So doctor's gonna say, hey, move this around, right? You move
Yeah.
it around or see it, and so he can hear it live and in color as opposed to again going into that brick and mortar.
Hmm.
So I can stream video from my ears, nose, and throat. I can
Hmm.
stream audio from a stethoscope, and I can stream data
Yeah.
from a blood pressure cuff or a glucose monitor or any other medical device, and you
Hmm.
can see it real time. That's what they refer to as a high acuity encounter,
Hmm.
um, because it's a more thorough assessment of your condition, and all that gets captured in the electronic medical record, and your
Yeah.
doctor can issue or establish a care plan based on that encounter.
Man, that's amazing. And so just by going through that, I mean, number one, you saved yourself, gas and just the time to go into the doctor's office. You got it done possibly pretty quickly. In your example was it was, 1 p.m., maybe the same day, maybe it's not always that type of turnaround, but I just mean in general. It's faster, the care is still there. You can also be in the follow-up program, as you mentioned, just depending on if you're already if you need to be on one. But the main thing that I always like to say is that this is just a benefit that adds to and to the healthcare system just overall. It doesn't mean that you can't, if the doctor, can't diagnose or do what he needs to do through the telehealth or the virtual care model. I mean, you can still go in. So it's just a big
Exactly.
benefit, in my opinion.
It's absolutely correct. It is an enhancement to the quality of service
Mhm.
again. So if it's urgent, if you're not feeling well, you call up
Yeah.
and they say, oh well, because the average wait time for an appointment is 21 days. So
Yeah.
you don't want to wait 21 days. You're sick today, not 3 weeks from now, right? So yeah, it's definitely the integration of the brick and mortar and a
Hmm.
virtual care setting allows you to provide that continuity of care, that continuous care model,
Yeah.
to maximize the benefit to your patients.
And then the other side of this, and I don't know if this is the best metaphor, but this is the one that I always come up with is when I think about like virtual care, is that if I think it expands the market. Like people that wouldn't have necessarily gone to the doctor before, or not gone until they had to go, or until they were like really far down the line, and now maybe it's a more of an acute condition, or it's just something more serious that could have been maybe caught earlier on, whether it be, that like it's expanding the market, and just by providing that care earlier on, it's going to be less pain for the patient potentially. It's going to be less burden also on the healthcare system, right? You're catching some things before they turn really bad. I feel like
Absolutely.
there's all kinds of different like offshoots there. Is that right?
Absolutely. You're the sooner you can level
Hmm.
set or establish that l- greater state of wellness, you're going to
Hmm.
reduce emergency room visits. If
Yeah.
you just got discharged from the hospital, you may actually reduce the readmittance, which is a penalty to a hospital. And you might be able, because you're being coached, if you will, you're
Hmm.
embedded into that remote patient monitoring chronic care management program.
Yeah.
The fact that you're coached, you can achieve a better state of wellness as opposed to I'll wait a month, 2 months, 3 months for my next checkup.
Hmm.
I'll just relax the day before and get my blood pressure down so my doctor doesn't yell at me, which is the
Hmm.
true scenario, by the way. So yeah, it is definitely allows that provider to provide a greater quality of care to his patient base, without a doubt.
What are some of the things that you feel make Genie MD unique, maybe from the rest of the marketplace in telehealth and other things? Like, obviously, I'll just throw this out there. You're a little bit more mature, right? Going on 10 years or over 10 years, versus a lot of other platforms. And nothing against them, but I just mean like there's something to it. So tell us what makes Genie MD unique.
Yeah, it's interesting you say that. Sometimes I get on the phone with a prospect and they ask me if we started during COVID, as
Yeah,
if that
exactly.
had. So I always say we're not a COVID startup. We've been at this for 10 years, so
Hmm.
we've seen it
Yeah.
long before it became fashionable, and have engaged health systems and self-insured
Hmm.
employers in school for the longest time. So the
Hmm.
but our differentiation is that full umbrella of services
Mm.
necessary for that provider to provide that continuous care. As I said earlier, some of our competitors focus on urgent care, some of them
Mhm.
focus on primary care. So I haven't heard one talk about continuous care, and that's
Mm.
ultimately what the differentiation is, because
Mhm.
we talk about care in the home, but in reality, it's care anywhere.
Yeah.
I can be in the mall, I could be in my car, I could be in my home, I could be at work. And
Yeah.
because, hey, I got a meeting at 2 o'clock, but I'm not feeling well. Let me do an urgent
Mhm.
call to my doctor, right?
Yeah.
Even if you're on the 15th floor and you don't feel like going to the nurse's office down on the first floor, right?
Yeah.
Let me just call and do a telehealth visit. It creates so many conveniences, and at the same time, it impacts the quality of life multiple times over.
Hmm. Who do you work who's the direct client? So are you working specifically with healthcare systems? Give us a little bit more on just the kind of the model of it all.
Yeah, so GenieMD works directly with healthcare systems, large
Mhm.
and small,
Mhm.
self-insured employers,
Yeah.
educational institutions, and payers. Those are our
Mm.
target markets, and we engage them very robustly, and get a lot of positive feedback about what it is that we're doing and how it is it's going to help their mission,
Mm.
and in regards to providing better healthcare,
Mhm.
whether it be a health system or an employer or educational institution, providing better healthcare is always top of mind for everybody.
Absolutely, and so for these healthcare systems, and as you mentioned, the employers, self-insured employers, the payers. So how do they kind of normally engage? Like, how does that conversation start with Genie MD? Is it typically like maybe they don't have a solution for this yet, and they kind of want to dip their toe in the water? Like how does that start up? Because I feel like a lot, obviously, men, if they're not using a system like this, then they need to. I mean, in today's marketplace, we'll say. But like, how does that relationship normally warm up?
So actually has been occurring because of the pandemic,
Mm.
when the pandemic started 18 plus months ago,
Yeah.
everybody adopted something. They had to just give me something because
Yeah.
my patients are at home, I'm at
Yeah.
home, I need to get connected, right? And the doctor's
Mhm.
offices were closed. So telehealth in the context of a video visit became
Mhm.
real. But now, because as I always say, Mikey liked it, the physician liked it, the patients liked it, and so the point there being is now they're starting to truly reimagine. Hey,
Mm.
this worked. This has
Yeah.
value. How do I extend care from my brick and
Mhm.
mortar facility? And because it's not telehealth and or virtual care isn't used 100% of the time from
Mhm.
every engagement, but
Yeah.
it definitely extends the quality of care into the home or anywhere where that patient might be.
Mhm.
So, or even the provider might be. So the point there being is it the conversation typically starts off by
Mhm.
some strategy that they have to move off of where they were relative to when they started in the pandemic, to
Yeah.
reimagining the delivery of care and integrating
Mhm.
virtual care into the delivery of care model. Virtual care, telehealth, remote patient
Yeah.
monitoring, chronic care management. new billing code next year, remote therapeutic
Mhm.
monitoring, which we also provide. So um, so a lot of different but then again, that all said, you gotta
Mhm.
crawl, walk, and run just in
For
monitoring. We'll
sure.
say, so typically we'll say, hey, if you're gonna do all monitor all these therapeutic areas, you might
Mhm.
want to start here first, then it escalate it,
Yeah.
and start with your patients with diabetes first, then
Mhm.
expand to um, hypertension, then
Mhm.
extend to respiratory, right? So there's a lot of different categories
Mhm.
you need to build programs around. It's just not about technology. It's about technology, people, and processes
Yeah.
and programs that ultimately create the successful model.
Well, Tom, I mean, I'll just say this has been great. So, learning more about what the future of virtual care looks like, really how value-based care plays into this picture, and improving patient outcomes, which is the goal of many. I mean, what's next? So, what's next for you? What's next for Genie MD?
Well, the market in virtual care is still young.
Yeah,
So we recently launched several new features of our platform, and it is gaining a lot of attention from our current customer base as well as
yeah.
attracting new, which is great. But what's next is really a lot of hard work, smart work,
Yeah.
relative to continuing to roll out and ultimately reach those patients. At the end of the day, no program matters unless you're reaching those patients, and that's really key is frictionless
Mhm.
healthcare, because that's ultimately what's going to allow patients to easily adopt this and move them forward as well as the
Yeah.
health system that's supporting them.
Well said. It doesn't matter if you can't reach the patient. I love it.
Yeah.
Boiled down, doesn't matter if you can't get to the patient. So I love it, Tom. So that being said, I mean, this has been great. If somebody's watching this and they want to learn more about Genie MD, I mean, what's the best way for them to do that?
There's a couple different ways. You can go to GenieMD.com,
Yeah.
GenieMD.com,
Mhm.
certainly. And there's a couple different ebooks that you could download.
Mhm.
And or send me an email, tom@GenieMD.com, and I'd be more than happy to engage and see how we can help you. And then certainly we're on social media, LinkedIn,
Mhm.
Twitter, things of that nature.
Fantastic. Well, Tom, really appreciate you coming on the show and really sharing your passion and your mission behind why you do what you do. And to the audience, as always, it's been great having you. If you're a first time listener or visitor or viewer, make sure you hit that subscribe button. We have many more mission based entrepreneurs, executives, and experts coming on, and we don't want you to miss a thing. And we'll have the Genie MD website and all that good stuff in the show notes. So you can just click on it right there, and it'll get you right over. And don't forget, hit that subscribe button. Tom, really, it has been a pleasure. Thanks again for coming on the show.
Adam, thanks for having me. Appreciate it.